ALS is a devastating and cruel disease. There is no cure for ALS, and ALS always leads to a premature death. On average, people live only 2 to 5 years after getting a diagnosis with ALS. Earlier this year, I lost my dear friend and former Chief of Staff, Elliot Ginsberg, to ALS, and previously lost in the year a dear friend, Danny Jones, who I went to grammar school with and played basketball, who later led Central Connecticut in his collegial years. Every year, approximately 5,000 Americans are diagnosed with ALS. Over time, people with ALS lose their ability to speak, to eat, to move, and even to breathe. They are unable to work due to their severe disabilities, and they lose their jobs and their employer-based health insurance. I've witnessed this happen to both them and, as importantly, their family members, and to see the agony and the suffering and yet the dedication and love that they go through. Recognizing the devastating nature of ALS, in 2000, Congress passed bipartisan legislation that waived the 24-month waiting period for Medicare for people with ALS. Today, we consider the ALS Disability Insurance Access Act of 2019. This bipartisan legislation will end the 5-month waiting period for Social Security disability insurance benefits for people with ALS. I want to give special thanks to Representative Seth Moulton, who has been a champion on this issue, along with the 305 members of the House of Representatives who have co-sponsored Representative Moulton's bill. I urge my colleagues to vote in favor of the ALS Disability Insurance Access Act of 2019. Our actions today will provide people with ALS quicker access to Social Security and Medicare benefits they have earned. I would also like to commend my colleague on the House Ways and Means Committee, Bill Pascrell, for his passionate leadership and untiring advocacy on behalf of those suffering with Huntington's disease, a terrible disease which affects children as well as adults. Today, we are passing this bill for many with ALS. But we also know there are many devastating diseases, such as Huntington's and metastatic breast cancer, which also deserves the same benefit and have bills in Congress that will provide just that. We need a solution for everyone. People with the kinds of severe disease and disabilities that qualify them for Social Security really need the benefits they have earned as soon as possible. I hope that in the next Congress we can try to help everyone by doing as Bernie Sanders and Lloyd Doggett and others have in proposing to eliminate these waiting periods across the boards. I urge my colleagues to support this legislation, and I reserve the balance of my time.